All right, let's change subjects a little bit. When in Rome, we have to learn a new language. Okay? Now, it's not hard. It's another language, but I'm going to help you along with this. You need to get this stuff down, otherwise you will be struggling for the rest of your life if you're going into the medical field. Okay? But especially something that's going to happen soon, you will have struggling occurring in A&P 1 and 2. All right? We'll be using these terms all the time. In other words, we are not saying words like, my nose is in front of the back of my head. We are going to say the words, my nose is anterior to the back of my head. So it's new words. Okay? So, terminology, like I said, not just for this class, but when you get into your fields later on, everyone will be using these terms because everyone will be on the same page. All right? When you go to Spain, you got to learn how to speak Spanish, otherwise they won't know what you're talking about. You want to ask where the bathroom is, instead of saying baño, you say bathroom, they're not going to understand what you're talking about. So you got to speak the same language. Okay? So you're going to need it for the rest of your life. All right? And it's not bad, it's just another language. So let's talk about first things first. Anatomical position. We will always refer to the anatomical position like this. Okay? This is where the body is erect, the feet are slightly apart, the palms are facing forward, with the thumbs that are facing away from the midpoint of your body. We always refer back to what we call the anatomical position. In other words, in this position, my nose is above my mouth. If I'm lying on my side, my nose is still above my mouth because I refer back to this position. If I'm standing on my head, my nose is still above my mouth because we refer back to this position. This allows you to explain things over the phone about how you're seeing that person lying down, either dead or not breathing properly, and you explain to the next medical professional, yes, and he has a cut above his nose. That person on the other line is understanding because you're using the same language, even if that person's lying on the ground or standing on the head. You see what I'm saying? You still refer to the anatomical position. You got to get this under your belt. If I'm standing like this, my hand is still further away from my torso over here. It's not above, it's going back over here. Okay? We always refer to this. Okay? All right, now, body position. Body is upright. But what about when a person's lying down in a reclining area? Well, we could say that the person's prone. Prone means that the body is facing downward. His bum-bum's facing the ceiling. As opposed to supine, like in a coffin. He's lying down, he's facing you. He's sunny side up. Makes a big thing that, yes, I saw the patient in the room and he was lying down on there. A lot of people will have a certain image. But if I said to you, the person was in there and he was lying down prone, now you might have a question. Well, why is he lying down with his bum too? Because he might have pain back there? You know, I don't know. But that gives you an idea, an image in someone else's eyes of how that person is. And that could also help detect or identify what's wrong with the patient. Okay? So, but we always refer to the anatomical position. That's what I have there in green.
You always refer to it?
Always, always, always. If they're prone, their nose is still above their nose. Always. Now, pertaining to which side? Unilateral. I cut the fallopian tube. I cut the unilateral fallopian tube. I cut one-sided, one fallopian tube on one side. That's what I did. As opposed to bilateral. I cut bilateral fallopian tubes. Both. Does that make sense? One versus the other. We could also say ipsilateral. That's on the same side. I cut my right ear, and there's also a cut on my ipsilateral arm. Which arm?
Right arm.
Right arm, the same side. You see what I'm saying? We also have contralateral. I had a stroke to my right brain, but I can't move my contralateral arm. the left one. You see how you're using this? Okay? Planes. These imaginary planes that go through the body. We have a plane that goes through the body that separates our body into halves. We have, it could be the front half and the back half. That plane that's going that way is something we call a frontal plane, also known as a coronal plane. You'll see on the next few slides. I have the other words here. What's that? Coronal and frontal are the same thing. You'll see it on the next slide.
If you're looking at that before this class,
Yep, same thing. So coronal and frontal, same thing. It gives you front and back halves. We could also cut straight down the middle, giving you left and right halves. That's called a sagittal plane.
So when there's things that are like in parentheses in terms of this terminology, is either one acceptable?
Absolutely. You're going to soon find out, good point, you're going to soon find out, and I don't get many laughs now, but in A&P2, they are chuckling away because they know exactly what I'm talking about. In order for you to master A&P, you got to know how to say one structure about 12 different ways. Because if I just talk about this as the frontal plane, and then you get into A&P2 and a different teacher explains to you as a coronal plane, you don't know what I'm talking about. So you got to learn all the terms. I don't care which one you use,
Okay.
but you got to use all the terms.
So the front and back half for frontal and coronal.
Coronal, yep.
Coronal.
Okay, front and back.
That you feel is both.
Either one, either one. If there's a question on a test, you could use either one. I'll give you full credit on both. But if you just study coronal and then frontal's on there as a multiple choice, you won't get it right because you won't know that that's there. So you got to learn all the terms. And believe it or not, I don't know all the terms that are out there. I'm trying to learn them as I gradually get. I only know like 9 terms for that, but there's probably about 12. So I'm still learning as we go along, right? The sagittal plane is going to give you left and right halves. If we go dead on right in the center and give yourself equal halves, then we say that that is mid-sagittal or a median plane. You'll see the next few slides. You'll see it on here. Just kind of an overview. But we could also make a sagittal plane going down our shoulder. Now we're still getting right and left halves, but they're not equal. Then we say that that's para-sagittal. Para means next to. In this case, next to the midline of the body. Okay? You'll see it on the next few slides. We also have a transverse plane, like cutting a woman in half. All right? A transverse plane giving you upper and lower halves. We could cut right through if we amputate the ankle, that's a transverse plane, right? So this is the frontal or coronal plane there. I'm using the 2 terms. Giving you front and back halves. Now this is a part of that quest I'm going to give you guys later on. You need to know these terms. For instance, you'll see, I thought that was the next slide over here. I jumped a little bit ahead. But you'll see there's certain sutures that we have here. We have a coronal suture and a sagittal suture. And you'll see when we get over there. So the frontal or coronal plane gives you front and back halves. A sagittal plane is going to give you right and left halves. So about the sagittal plane, if you go dead on right in the center, then we say that's a mid-sagittal, also known as a median plane. They will give you equal halves. If you're going to go down, let's say, the shoulder, or slicing off your ear, right? Then we call that a para-sagittal plane. Because para means next to the midline. It's not on the midline, it's next to. And they're going to give you unequal halves. The transverse plane, kind of going through there. Oh, this is what I want to show you. If you look at the top of the skull, you're going to see these sutures. Basically, they're areas or articulations between 2 bones. There's one suture, and here's the front. Here's the you look at the top of the skull. Here's his nose, and here's the back of the skull. So we have a suture that goes over here. That's giving you front and back halves, so to say. So we're going to call this the coronal suture. We also have another suture that goes down here, giving you left and right halves. That's called the sagittal suture. This is the reason why I need you to know these terms going into the musculoskeletal system. All right, so that when you get into that system, all you have to worry about as a new word is suture. You don't have to worry about coronal or sagittal. Okay?
Can you go over transverse plane again?
Yeah, transverse is just like parallel to the floor.
Okay.
Okay? All right? So it's just showing you different planes over here. If we were going to cut right through the belly, a transverse plane through the belly, you don't have to worry about too much, but here's where the belly button is, and here's the backbone. 2 kidneys are there. So it's kind of like making a transfer. Like you're cutting a woman in half like a magician would. Okay? Now, a couple other terms for tubular structures. We can also cut through here, and this is called a longitudinal section. When we lift it up, it looks like this. Kind of self-explanatory, okay? But if this is your intestines and the food is going down here, if we actually cut right through here as though it's perpendicular with the trajectory of the food, make a perpendicular cut there, you will make it so that it's a complete circle. This is also known as a transverse cut because it's perpendicular with the lengthwise of the tubular structure, blood vessel, small intestine. If it goes on an angle, then you're going to get more like an oval shape. Does that make sense? And in this case, this is called an oblique cut or an oblique section, and that's on an angle. Mm-hmm.
And the transverse one is just straight.
Transverse is perpendicular. Oblique is on an angle. Does that make sense what that is? Okay? You'll hear words oblique with muscles and stuff. Okay? Now for radiography, okay, just so you can see how we could use this, there's something called tomography. Tomography is something where we're going to do sections very close to each other so that we can have a 3-dimensional image drawn out. In this case, we can actually cut a section here, a section here, a section here. Not actually cut the person, but we could do this through something called a CT scan, or also known as a CAT scan. Okay? Which CAT scan stands for computerized axial tomography. Okay? And what this is that we can get a certain section to see where the kidneys are, and we can go up and up. We can see a little bit higher how the kidney looks, lower in where the kidney looks, and so forth. A serial kind of cut that we're seeing over here. Now, CT scans can only do this kind of a cut, can only do transverse cuts. But they started realizing that, and that's why they call it axial, because it's going through the axis of the person's body, like a wheel axis, it's going through that. So that's why they call it computerized axial tomography, okay? But they started realizing that we can actually bend our knee, and we can look at the knee in different angles also. So because of that, it's not only going through axial, but it's still giving these same cuts, but the way you're positioning the body gives it different angles. So sometimes they'll just call it as a CT scan. It's not just axial anymore. That's why we see CT scan, CAT scan is basically the same thing. However, MRIs, magnetic resonance imaging, allows you to do so many different cuts. You could do sagittal cuts. You could do coronal cuts. You could do transverse cuts. This allows you to really understand and look at what you need to look at to help diagnose. And there's pros and cons with MRIs versus CT scans. CT scans you can't use on a pregnant woman. MRIs you can. But MRIs are very loud. And if you're claustrophobic, I wouldn't put you there because you're going to be in there for 40 minutes or so. Who here has had an MRI? Okay, few of you. Okay, right? Am I saying it's loud? They kind of give you music to listen to, and you can't move. You got an itch, they got to start over. So it has its pros and cons. We get better imaging for the most part, but there is some, certain people are not good candidates for this. Question?
Are you saying they take a bunch of sections and then they make it into a 3D?
No, what happens here is that, if I go back to, this is like a CT scan, not in color, but a CT scan. But you can see, this is a kidney here, and there's a kidney here. You gotta look, you're getting cut this way. But we want to look at the tip of the kidney. So they're going to do a few sections even above that and see if there's cancer up there. And we could actually measure how long that cancer is, if it's in the kidney or not. So we create this mental image in our head when we look at the different serial cuts. The Does that make sense?
Yeah.
Okay? All right. I wouldn't ask you anything about tomography. I'm just giving you, especially for people in radiography that are going that way, or if you yourself is going into, going to have a CT scan. That's what it's all about.
Okay.
That's why you're going to be in there for a long time. Well, it's not. I don't want to get into what the mechanism how MRIs are formed, but they got to be in there so that the alignments of your electrolytes go in a certain way. So you got to be in there for a long time. But any questions about that? It's more like an FYI.
Okay, so is the orthogonal
No.
But I know the section.
Yeah. Oh yeah. The other stuff about anterior, posterior, about the planes and stuff. Yeah. All right. Now let's look at directional terms. Okay. No more are we saying front of and back of. Now we got to say anterior. So anything towards the front is anterior. Anything towards the back or away from the front is posterior. Now, we can also use terms as dorsal and ventral. Ventral means going towards the belly. Dorsal means going away from the belly. Now, in a human, they kind of mean the same thing, but they don't mean the same thing. Let me show you what I mean. I do pretty good drawings, schematic drawings, but it comes to animals and people. So stick figures is what I usually do. Does that make sense? All right, everybody knows what this is, right? Okay. So this is, yeah. So going towards the front is, and I'm just going to abbreviate to speed up time, but you wouldn't abbreviate. But going towards the front is anterior. Going towards the back is posterior. Going towards the belly is ventral. Going away from the belly is dorsal. Now that makes pretty much sense until I give you our furry little four-legged creature. And that could pretty much be any animal. You can see it's got a long snout, could be an elephant. It's got a fairly long neck, could be a giraffe. Could be anything I wanted to, right? All right. But look what's happening here. Going towards the front is anterior. Going towards the back is posterior. We're okay with that? Look at the belly. Going towards the belly is ventral. Going away from the belly is dorsal. So they don't mean the same thing. Please don't think they mean the same thing. It's just that in a human, it's the way we're positioned. And in fact, if you know anything about fish, there's a fin that goes on a fish, like a shark. What is that fin called? Dorsal fin.
That's how I remember those things.
Yeah, the dorsal's on the back, and that's what that is. Mm-hmm. Okay, does that make sense?
There are two different terms.
We could use both dorsal and ventral, anterior and posterior, but we see a lot more. We see both. We see both. So you need to understand the concept. They don't mean the same thing. In a human, they basically do, but it doesn't. Does that make sense? I know it sounds weird what I'm just saying, but they don't mean the same thing, but it's just the way we're positioned. They happen to be the same thing. Okay? Medial and lateral. Anything going towards the midline is medial. Anything going away from the midline is lateral. Now, let me just, before I do the medial and lateral again, let me go back to anterior and posterior. My chest plate is what to my heart? Anterior, posterior. My chest plate, anterior. My heart is what to my vertebral column? Anterior. My spine is what to my nipple? Dorsal or posterior? Okay, does that make sense? You know how to use this? Okay, now, medial and lateral. Anything going towards the midline is medial. Anything going away from the midline is lateral. My ear is what to my nose? Lateral. My shoulder is what to my Adam's apple? Lateral. My belly button is what to my love handle? You should say, you don't have love handles, Dr. Gamaro.
I was gonna say no, it's rest.
Okay. But let's say my hip. My navel is what to my hip? Medial. Is that clear how to use this?
It's cool, it is, yeah.
Mm-hmm. Okay. It's not too bad. Now, superior and inferior. Anything going towards the head is going to be superior. Anything going towards the feet is inferior. We also use terms as cephalodad and caudad. Cephalodad, also known as cephalic, is going towards the head also. But anything going towards the rump or your tail, as I showed you before, an embryo has a tail, we say that it's caudal or caudad. So this is actually wrong in terms of that. This picture is showing you that the arrow is going towards the feet and we call that caudad. No, that's what I wrote here. Caudad is not going to your feet, it's going to your rump or your tail.
So it's not a directional, it's just towards that location.
Towards that, well, it's directional, it's going towards that way. So we have problems because if I said to you, your knee is what to your foot, you can't, it'd be superior, it would also be caudad or caudal. I wouldn't ask you that. We don't usually see caudal often. We see that couple things in the nervous system, but not much. Because we don't have the tail anymore. So we don't usually use it as much. We use superior and inferior. Cephalic we use. But caudad, there's confusion that can happen, especially when you get to the legs. It's there. If someone uses it, at least you have an idea it goes towards the tail or the rump. Okay? So we also, superior and inferior, when you get to the heart, we have the superior vena cava and inferior vena cava. All right? Just an example. In superior is blood is going to return to the heart from above the diaphragm, and the inferior vena cava is going to be blood that's going to return to the heart from below the diaphragm. Inferior, superior vena cava. You don't have to memorize this. I'm just showing you you're going to be using these words throughout the rest of your career. This one throws people off, and I don't know why. Proximal and distal. When we have this little embryo over here, the way that the arms are actually formed, they come from, and these are brachial arches, but it's really coming from here. But it's coming from the torso, and you got this little hand that comes out. Okay? The arm limb, or the limb bud as we call it, comes out over here and goes out that way. So it comes from our trunk and goes out that way. The way we use proximal and distal is referring to arm limb, or limbs, arms and legs, and also tubular structures. But let me talk about the arms and legs first. Proximal is anything that's going to be closest to the point of origin, anything closest to the trunk. Distal is going to be anything further, a distant from it. Distal. My elbow is what to my wrist? Proximal. My shoulder is what to my thumb? Shoulder is what to my thumb? Shoulder from the thumb. It's proximal. It's closer. My shoulder is closer to my origin than my thumb is.
How's the postal?
What?
Wait, how's the postal? I'm not sure about that.
It's how what?
Wait, how's the postal?
What's postal?
Oh, proximal.
Proximal. Proximal is closer to the trunk. Distal is going to, my wrist is what to my shoulder? Distal. It's further from the point of origin. Does that make sense? This one, I don't know why, but it usually drives people nuts. but it's like an epiphany. Once it hits you, you're like, why did I have a hard time in the first place? That's what it'll do. You just got to practice it. My knee is what to my ankle? Proximal. My groin is what to my knee? Proximal. My great toe is what to my groin? Distal. You see it? Okay? Now, let's talk about tubular structures. Let's talk about your digestive tract. We got to know where the point of origin is, where the food goes in. So my oral cavity is where the point of origin is. Anything further from that is going to be distal. My stomach is what to my esophagus? Distal. Remember, the esophagus is a tube that goes from our mouth to the stomach. My rectum is what to my stomach? Distal. My esophagus is what to my anus? Proximal. All right, you getting it? Okay? Port of origin for our food is going to be where the mouth is. So if I say that, you know, he had, someone does a colonoscopy and he removed a cancer site that was 2 centimeters distal to the stomach, you should know where he's talking about. You see what I'm saying? And they'll be using those terms, distal and proximal. If you become a nurse working with a cardiologist or a gastroenterologist, they'll be using those terms. Okay? This one's pretty easy. Superficial and deep. Right? Superficial cut, deep cut. Internal bleeding, external bleeding. That was pretty easy, right? Okay. Okay, body cavities. Just about done with this part. Body cavities. We have 2 sets of body cavities. We have ventral cavities and we have dorsal cavities. The dorsal cavities are in blue, and they're going to be, basically there's 2 parts there. Cranial cavity and spinal cavity. The cranial cavity holds the brain, the spinal cavity holds the spinal cord. Then we have the ventral cavities. This is a little bit more advanced, not advanced, but complex, a little bit more to it. We have the thoracic cavity that's going to hold our lungs and our heart, amongst other things that are there. And then we have this physical barrier between the thoracic cavity and the abdominal cavity. That's the diaphragm. The diaphragm is going to separate these 2. It's a physical barrier there. Then we have this abdominal cavity and pelvic cavity. A lot of people, including myself, we don't consider this 2 separate cavities. So sometimes we'll refer to it as the abdominal pelvic cavity, because there is no physical barrier here. Okay? Abdominal cavity has a lot of organs in it. Pelvic cavity, mostly reproductive, but the rectum's in there, urinary bladder's in there too. So the significance of this. If I have pneumonia, which is an infection in the lungs, it's going to take it's going to be very difficult for it to actually get into the liver that's in the abdominal cavity, because you have that physical barrier there. The diaphragm. Can it? It can, but it's difficult to do that. However, if I have a ruptured appendix that occurs in the abdominal cavity, and there's a lot of feces in there, when it ruptures, a lot of bacteria that goes in there, now it spreads all over the cavity. It's going to go down on the fallopian tubes in the pelvic cavity and destroy them. So ruptured appendix can cause a woman to be infertile. I think there's bigger issues to worry about when you have a ruptured appendix. I'm not worried about fallopian tubes at that point. I'm worried about saving her life. All right? But the thing is, if she does survive, that's what I'm saying, is that there is no connection there. Likewise, a sexually transmitted disease, gonorrhea, chlamydia, can easily get into the pelvic cavity and can spread to the liver. That we see often, because there is no physical barrier there. So again, physiology reflects anatomy. Function reflects structure. it makes sense why you would destroy the fallopian tubes if you have a ruptured appendix, if you understand the way the anatomy is in that person. Okay? Regional terms. Boy, you're going to hate me on this one. This is called the thigh. Well, that's what you're coming into. We're called the thigh. Not anymore. It's now called the femoral area. This is called the wrist in layman terminology. Not anymore. It's now called the carpal area. Because the bones, there's 8 bones in your wrist, and they're called the carpals. There's a bone in the thigh here called the femur. So you need to know all of this. All of it. And it's going to help you with everything.
So in this case, it's the parentheses, parenthesized word that
Right,
matters.
right. You know the layman term, like thumb, but now we need to know pollex. Does that make sense?
Yeah.
So you need to know all of this. This is something that probably you'll get this all down to, like antecubital areas where the nurses like to give you venipunctures, right in the anterior aspect of your elbow. Right? That's called the antecubital fossa, which you'll learn about later. There's a lot of games that you could play on the internet. If you Google things like anatomy terms game, you'll see like a body over here, naked body, and then you'll see words like, I'll show you later. I'll show you in a moment. Let me just finish up here. Yeah, something like that.
Oh,
And
so-
so there's a whole bunch, and you just drag things over to the areas and bells ring and
Yeah.
stuff. But you got to commit this to memory. So when I do on my quest, which is going to happen in a few weeks, when I do on the quest, I'm not going to say what I've been saying to you now. The elbow is what to the wrist. I'm going to say the antecubital area is what to the carpal area. See? You got to train you. It's kind of like you're learning Spanish in the Spanish class. Well, the teacher's only going to speak in Spanish. All right? You've got to learn how to use this. If you're going to know how to swim, you know, I think it's pretty cruel, but let's throw you in the water and you'll learn how to swim. All right? But you got to learn. But it's not so drastic as that. You could go on the internet and look at these fun games that you could do, which I'll show you afterwards. So I don't want to sit here and just explain all these different parts. It's not going to do you any good. It's just going to go in one ear out the other, or one otic area to the other otic area. Okay. But just memorize it. Okay. I've seen people just work with partners and have sticky notes and just, okay, there's the otic area, there's the maxilla area, and so forth, and just stick them all over. Whatever works for you. There's a lot of different ways. You can write on their bodies, get sweatshirts, get sweatshirts, you know, like a white sweatshirt and a white sweatpants, and if you want to do it that way too. But it's costless if you use the use the internet. But I'll show you where a couple are. I just want to show you the abdominal regions, and then I think that'll be it. We're a little bit behind, but we'll get to it. All right, so abdominal regions. Okay, we can either talk about 9 regions or 4 quadrants. Okay, the 9 regions, you only have to memorize 6. And I'll show you why.
I have to know 9.
There's 9, but I'll show you. You'll be able to, you can figure it out, right? Yeah, exactly. So here you got the umbilical area, or umbilical region, which is going to be where your belly button is. Your umbilicus goes there, your umbilical cord goes there. Makes sense. This is called the epigastric area. This is called the hypogastric area, also known as the pubic area. You can use either or. This area here is called the right hypochondria. Now, chondro means cartilage, and hypo means under. When you look at the ribs of the skeletons, you'll see that there's cartilage there. So they call this under the cartilage area. I would call it something else, but who am I, right? So we call this the hypochondriac area. This is the lumbar area. This area here is either called the inguinal or the iliac area. You'll start learning that there's also called the ilium there for the bone. So if you know these over here and these over here, it's pretty manageable to do these. Because if you know that's a hypochondriac, that's the right one, there's the left one. That's why. You need to know all 9, but there's only, you could do this in 5 minutes. Right? It's not so hard. But you also need to know where organs are located in those regions. All right? So the spleen would be up here in the left hypochondriac area. You see what I'm saying? So if someone's got epigastric pain, you're thinking stomach, you're thinking liver. You're not thinking appendix, you're not thinking spleen. Do you see what I'm saying? So that's why they use these terms all the time in your future, okay? Now these are the 9 regions, but we also have 4 quadrants, and they're a little bit easier to manage, okay? Right upper, right lower, left lower. And you should know the organs that are in there, okay? Not too bad?